Hi, and welcome to NUR158, Nurse Assisting at Mesa Community College. My name is Nicole Bartru, and I will be your instructor. You'll also meet our other instructor in just a minute. We're going to introduce you to the lab today and go over some basic safety rules. So we're excited to have you, and welcome.
Hello, my name is Lisa Kirkby, and I will also be one of your instructors for NUR158. And welcome to the class. We are very excited to have you, and let's get going. Hello, since this is a video on safety, we will be practicing safety for COVID-specific guidelines that will be in another video that you will be introduced at a later time. But for today, we are going to be talking about fire safety. So if in the case of a fire drill, you would need to make sure that you leave your possessions and exit the building at the closest exit, and we will be meeting across the parking lot. So the fire extinguisher is located on the west wall of the lab, and if in case there was an actual fire, there are two acronyms in which case you want to follow. We have PASS and we have RACE. For PASS, it is pull, aim, squeeze, and sweep. For the RACE acronym, it's rescue, alarm, contain, extinguish, or evacuate, whichever would keep you the most safe. Now when it comes to public safety, the phone number is located right here. You would want to put that in your phone. It is 480-784-0911 in case you were to ever need that in an emergency.
This is where you'll find our MSDS binder, Material Safety Data Sheets. You're going to learn more about these, but this is where you locate any hazardous chemicals or any chemicals that we have in the lab and all the details about them. So you can find that here, and this will always be located in that bin. All right, so here's where you will find our linen carts. Everything linen is located in these two shelving units. This one is closed, this one you can see is open. So if you're ever looking for something, come to the south wall over here. You'll find the pillows usually located on top. We have washcloths, it's all labeled here for you. Hand towels, bath towels, waterproof pads, disposable waterproof pads, gowns, pillowcases, fitted sheets, draw sheets, flat sheets, bath towel, the comforters, and then the adult briefs. So if you have dirty linen that needs to be put away, it never goes back into the clean linens. It's gonna go
in the dirty hamper. Your safety is always a priority, and if it were ever in the event of an active shooter, we would want to make sure that you stay safe. So you want to turn the lights off and remain out of view. There are two doors on the north and south side of the lab that have a window, so you would want to make sure that you stay out of the view of an active shooter. The best way to do that in this lab would be to see if you can crawl underneath the bed and pull a curtain so that you can remain out of the view of an active shooter.
So in our lab, you will notice that we have lifelike mannequins. These are also referred to as Sims. But when you're in the nurse assisting program or nursing program, these are your patients or residents. You should be treating them as such. So we take very good care of them, and we always call them by their name. This is Mrs. Gray. You will meet our other Sims as well. They are a family, and they should be treated like patients. They are very expensive, so please handle with care and take care of them like they were your own family.
Now we need to keep Mrs. Gray safe. In order to do that, we want to make sure that if we are going to be moving the bed, that we are going to raise the side rails so that she doesn't fall out. But if she is just resting in her bed, the rails would need to be down because that is considered a restraint. Now, if we needed to lower the head of the bed, you're going to hit the chair out. Now, each bed is different, but it's this specific one. You're going to hit chair out, and it will lower her head. Chair in will raise the bed. Now, you can also raise her knees if necessary, and you can also position the bed depending on her needs if you needed to even have her tilted. Now, a specific safety feature that you must always keep in mind is you need to have the bed locked at all times unless you are moving the bed. you always lock the bed before you leave the room. In order to do that, right now the bed is locked. It is not going to move. To unlock it, there is a brake. You unlock the brake, and now we can move the bed as needed. Now I am done with the care of Mrs. Gray, so I want to make sure I lock the brake, lower the side rail. The call light is always within her reach, and she will have her possessions within her reach at all times to keep Mrs. Gray safe.
So you'll notice at every station there's a bedside table, hand sanitizer, which we'll go over in detail, and this is the call light that always needs to be at the patient's side, and their water. So this is always going to be available at every bed, and you need to make sure that it gets placed where they can reach it. In the bedside dresser, you will find in the top drawer alcohol wipes, dentures, a denture brush, and a patient welcome kit. In the second drawer, you will find a bedpan or fracture pan and a graduate to measure fluids. In the third drawer, you will find the bedpan and the male urinal.
A couple more safety things to mention is this is a wheelchair. You always want to make sure that before you place a patient in the wheelchair or before you remove them, you want to engage the brake. To do so, you just push the lever so that it locks the wheel and the wheel will not move. This will keep your patient safe. Another safety feature is to make sure that they have feet covering so that they don't slip on the surface of the slippery floor. Before you get them out of bed, you always put their slippers on them before you stand them up. When they're in the bed, they can be wearing non-skid socks. In certain skills, it is very specific which ones that you use. So make sure that you read and pay attention.
Always know that we have an emergency first aid kit available for you. It's typically located in the cabinet labeled first aid kit. So these are what we call sharps containers or biohazard containers. In this lab for NUR158, we aren't using any sharps, but if we were, or if you were in the nursing program, or if you came across sharps wherever you work, always know that they go into these special containers labeled for sharps. One thing to always keep in mind is that you never ever want to put your hands anywhere near the entrance because sometimes needles can be sticking out. They should never be completely full. They should be emptied when they are about 3/4 of the way full. If you have any questions about where your sharps are located or how to handle them, always speak with your supervisor. When you enter the lab, you'll notice a little cubby station. This is the only place that any liquids should be. Due to COVID-19 restrictions, you may not be allowed to bring any liquids in the lab. If so, they would always go on this cart. You will also notice that we have the lab rules posted here for you. These rules are to be followed, and if they are not followed, you may be asked to leave the lab or discontinue class.
In the event of a fire, the fire poles are located on the north, south, and west walls of the lab.
So outside the lab, you'll find where our AED is located. This is a defibrillator that is user-friendly. Anyone can use this. It has directions and it's very self-explanatory. If you ever have an emergency and feel that you might need it, please use it. That's what it is here for. So this is where it's located, right next to the restrooms outside, and this could save someone's life.
In the event of a fire drill, this is where we will meet outside. You want to make sure that we meet outside. Do not go to your vehicle and do not leave campus. We need to take a roll call of everybody and make sure that everybody is accounted for.